This is why I talk so much about dysautonomia. One of the most frequent criticisms that I get on this app is the fact that I'm talking about dysautonomia despite being a chiropractor, which is perfectly valid and fair because our basic training doesn't really cover dysautonomia at all. But my life and the people that I care about have been impacted by things like POTS and vasovagal syncope. I've had ex-girlfriends who had POTS, my wife has vasovagal syncope because of lupus, and as someone that works with concussion and vestibular issues, one of the most frequent things that people will come in with is the complaint of dizziness. And a lot of these people will have dizziness because they have an autonomic nervous system problem, not necessarily because they have an inner ear disorder. And by far, the most frequent complaint I run into when I'm consulting with patients who have dysautonomia is that when they tell their doctors their list of symptoms and complaints, instead of doing a thorough deep dive about what's going on with them from a physiological standpoint, many of these patients are often discarded as having anxiety and depression, and they're given psychotropic medications to try to address these symptoms. But from my point of view, none of these patients seem like they had a psychiatric diagnosis, and that we should actually spend some more time evaluating the physiology. And even though I'm not a medical doctor that's going to treat these conditions with drugs, it behooves us as people that are in the chiropractic and rehabilitation space to be able to know and understand what's going on with these patients who have autonomic disorders so that we can properly direct treatment and rehab to actually improve their quality of life, even if we're not treating the underlying cause of their illness. Because we don't necessarily need to treat the cause of the disease to actually have an impact on quality of life. Because the first time I ever took care of someone with POTS was back in 2011, where most people had no idea what POTS even was. Because they were coming to see us for headaches and facial pain, and we treated the headaches and facial pain pretty effectively, but as a side benefit, they also started to notice that they had less lightheadedness too. So that took me down this rabbit hole of exploring how can head injuries and neck injuries actually affect autonomic dysfunction. And that took me to reading consensus guidelines because I needed to know, what do I do with these patients when they start to come in and they've never been diagnosed before? Who do I send them to? What tests should I order? And I've taken hundreds of hours of coursework and seminars to really learn and understand POTS, learning from the people that are doing the best work in the rehabilitation space for these disorders. And all that goes to say is that none of us have all the answers for dysautonomia. We're all just trying to do our best to try to understand this complex chronic illness. Because before the COVID pandemic, POTS was super underrecognized and underdiagnosed, and a lot of these patients are often discarded as having psychosomatic symptoms. And the hard truth is that there are no cures available to us yet. But I do have some optimism because I do think immunotherapy is going to be the future and it could have a functional cure for POTS one day. But those cures might be many years away. And until then, all of us, whether it's an MD, whether it's a speech therapist, whether it's a chiropractor, or a physical therapist, we're all just looking for safe and effective ways to improve the quality of your life.